Hey everybody, hoping that this video makes it to the channel because I've been having some video camera problems. As you all know, I'm 32 weeks currently, and so I'm making this video because I want to talk about one of several issues I had while I was pregnant, or during this pregnancy up to this point, because I'm still pregnant. Something new could pop up in a couple weeks and there you go, another video. I had a problem starting during the first trimester where I was getting boils on my legs. I was getting these boils, and I never, by the way, had a boil on my leg before, okay? Not ever. So I was surprised. I didn't know what it was. I just thought it was a pimple at first, and then it swelled up, and then it got really liquid. It was a typical boil. It went through the whole process. My mother told me, put some heat on it, draw it out, clean it really well, put a Band-Aid on it, you're fine. Well, that would work ordinarily for most people, except I got another one on the opposite leg. So the whole theory of getting the head out had nothing to do with the opposite leg. So I got one on the opposite leg. So as that one cleared up, I got one back on the initial leg. And it just hopped from leg to leg until I had like 7 of them. And I was like, something is not right. So I went to the doctor. They put me on antibiotics and they gave me a shot. Okay, I guess the shot was to take care of some other symptoms, but the antibiotic was to take care of the boils. Boils stopped. I didn't know exactly what boils were all about, but turns out that the infection, the skin infection that causes boils, is staph infection. And they cultured my boil when I went to get the antibiotic and the shot. They cultured it and found out it was MRSA, which, if you don't know what MRSA is, it's MRSA, its initials, and it stands for staph infection that's basically resistant to penicillins, which means it's harder to treat it, which is how they came up with the antibiotic that they were going to give me, because they figured out, oh wait, you know, one, I'm allergic to penicillin, methicillin, amoxicillin, all of those anyway. Second thing, even if I wasn't allergic, this particular infection does not respond to it. So anyway, they gave me Bactrim, which is an antibiotic. Went through that whole process of taking it, made me sick as ever, but I completed it. Then, about 4 weeks ago, here I am getting into the 3rd trimester. These boils come back. I didn't have them any of the 2nd trimester. They came back with a vengeance. Went back to my doctor. She told me, well, we gotta treat it again. And she told me that when I go to the hospital, because they have confirmed that it's MRSA, they will be putting me on, I guess it's called contact precaution, I think that's the title for it, where they're gonna have like these special gowns and they're gonna treat me like a science project while I'm in there. Great. As if I don't feel awkward enough giving birth in this place, I'm going to have these people with masks and gowns as if they're walking into surgery instead of just delivering a baby. So I had to take a different round of antibiotics, and finally this stopped again. But if you are pregnant, I want you to know that if you get boils, especially on your thighs, but anywhere, if you start to get boils, or if you have them already and you're pregnant and you notice that you're still getting them, whatever the case may be, please, please, please go to your doctor and check them out. Even if you've been treating them yourself just fine, make sure you check them out, because there is a slight chance that you can pass infection on to your baby. And not only that, your doctor needs to know so they can culture them and make sure that they take the right precautions when you go in to deliver, because MRSA can be fatal to people in the hospital that might come into contact with your germ. The hospital's full of sick people. Even if you're in labor and delivery, you know, your nurses are still going from room to room. They're sanitizing, they're cleaning, but remember, this is an infection that won't even die with penicillin. So obviously they have to be extra careful with you. So if you're having problems with boils, just know it can be treated. I actually got a recommendation from a different doctor as far as ways to help treat it. She recommended that you use Bactroban, which is a gel or cream that you can use on your nose. I haven't filled my prescription yet, but I think I'm going to do it, even though the infection itself is cleared up. She said use Bactroban on the nose. That'll help kill the bacteria because staph lives around your nose, even though you can have outbreaks anywhere. And she suggested to soak maybe 5 or so nights out of the week, soak in a very weak bleach solution. She said like a half a cup of bleach to a tub of water, less than what's in most pools. Soak in that for 15 minutes to help kill the bacteria. Wear loose clothes, keep the areas clean and bandaged wherever you have the boils, and of course clean it thoroughly when a boil should happen to burst. Clean it thoroughly, thoroughly, thoroughly. Peroxide after you use an antibacterial soap, and use antibacterial soaps. Cut out your perfume stuff that smells good and makes you feel nice. Cut it out just for the week and use Dial just to get the skin clean and as clean as possible, maintaining that clean balance so that what you're using can take effect. So those are her suggestions to me. I'm passing them on to you. Oh, one more thing. Clean towels, clean sheets. I've been using nothing but white towels that I bleach each and every time that I use them, and I use them one time and then I wash them. Like I have a stack of them. I was weird about that anyway. I always use towels just once, but with this it was even easier. I use only my white towels and I use them once and I wash them, bleach them, and I have a bunch of them so that I don't have to do this every 2 or 3 days. So that helps too, just keeping your sheets clean, which I have white sheets. I wash, bleach those. I don't bleach those every night, but at least once a week the sheets come off. I change them out and I bleach the sheets that I sleep on. So that's just some thoughts on how to keep the skin clean as you're trying to treat your boils / MRSA, whatever it may be, or staph infections. So that is all, and I hope this helps someone, and I will talk to you all soon. Bye.